Good morning, everybody, and welcome to Mesothelioma UK's Patient and Carer Event 2021. We're delighted to have all of you join us today for what we hope will be an interesting and interactive day. I just want to say a special thanks to Bristol Myers Squibb. This event has been made possible thanks to their generous donation. As I say, we hope the day will be interactive, and we would encourage you all to pose questions to everyone who's speaking today using the chat function on Zoom. We will have two panel sessions where we can put those questions to them. For those of you who don't know me, my name is Carolyn McRae and I'm a Mesothelioma UK clinical nurse specialist. I'm based in Glasgow and cover the west of Scotland. I'm also the CNS team leader for Scotland, and I'm delighted to be here today with my colleague Anne Moylan, who will introduce herself and talk you through today's agenda.
Thank you, Carolyn. My name's Anne Moylan. I'm the Mesothelioma UK nurse based in Portsmouth and covering the Wessex region, so quite a big area on the south coast. We have a really interesting and interactive programme for you today, including some breakout rooms later on, just before lunchtime. We will tell you how to access those rooms a little bit nearer the time. We appreciate that sometimes PowerPoint can be difficult to read on Zoom calls, and the presentations and the slides will be available to you after the day. So I'm going to hand back to Carolyn to introduce our first speaker of the day.
Thank you. So to discuss an overview into the coroner's inquest, we have Mr. Ivan Cartwright. Ivan Cartwright is the area coroner for Leicester City and South Leicestershire, where Professor Catherine Mason is the senior coroner. Ivan took up the role on the 1st of June 2020, having worked as a part-time assistant coroner in Nottingham between 2013 and 2020. Prior to June 2020, he also practiced as a barrister for 25 years, working in a variety of legal fields, first in Liverpool and then in Nottingham. He is married to a GP and has two young sons. Thank you, Ivan, for your presentation today.
Good morning, everyone. My name is Ivan Cartwright. I'm the area coroner for Leicester City and South Leicestershire. I'm going to speak to you today a little about the coroner's inquest and what to expect, what happens, what the coroner's task is, and how an inquest might progress if one is required in relation to the reporting of a death as a result of an asbestos disease, and more specifically mesothelioma. As I said, I'm Ivan Cartwright. Very briefly, in terms of background, I was a practicing barrister in Nottingham and before that in Liverpool between 1995 and 2020. And from July 2013, I also worked as a part-time coroner, called an assistant coroner, in Nottingham City. After that, and more recently, from the 1st of June 2020, so really a couple of months after the COVID pandemic lockdown commenced, I've worked full-time as a full-time coroner or area coroner in Leicester. An area coroner is really just the name given for the senior coroner's deputy. So I work with and under the senior coroner for Leicester City and South Leicestershire, being Professor Mason. Just a very little about coroners. Coroners are independent judicial officers who investigate deaths that are reported to them. That means that although there is a senior coroner for each of around 90 geographical areas in England and Wales, and some of those senior coroners work with area coroners and assistant coroners, the resources, the staff, the premises are almost always provided by the local authority, including court premises. A coroner, however, is independent of the local authority and answerable only to the chief coroner as well as other judicial regulatory bodies. That is, the coroner is not an employee of the local authority. Let me talk a little about what happens immediately after a loved one passes away from an asbestos-related disease such as mesothelioma. It doesn't need me to tell people and to explain that it can be a very difficult, confusing and distressing time for those who are left behind. If there is a suggestion or a possibility that the death has been caused by an industrial disease, such as an asbestos-related disease like mesothelioma, the death must be reported to the coroner. Now, there are a number of reasons and a list of which deaths must be reported to the coroner, but I'm not going to go through them all because certain deaths are not relevant to what I'm going to talk about this morning and what you perhaps would like to hear. Certain deaths, though, that are caused by industrial diseases or work-related deaths are always reported to the coroner, and it is usual that an inquest will always follow such a report of a death to the coroner. After the death is reported, and that usually happens within days of the person passing away, the coroner will open an investigation and will proceed to list an inquest into the death, specifically looking at a number of questions which I'll come to shortly. I hope that this short introduction will help somewhat to relieve any anxiety that anyone might have about the inquest process, and also help a little about what to expect when the coroner's office, through the coroner's officers, get in touch with the bereaved family following a death. Now, some common questions which I hope are of assistance in answering. Firstly, will your loved one have to have a post-mortem as part of the inquest process or the investigation? Let me try and assist with that first. If doubt about the medical cause of death, the coroner will usually request a post-mortem examination to be carried out. The coroner will consider all relevant factors, including the family's wishes, as to whether they will order a post-mortem or not. However, the final decision is the coroner's alone, and they need to be mindful of their wider legal duties and responsibilities. That said, in the majority of cases in my experience, there is no or little doubt about the cause of death, as a hospital doctor or sometimes a general practitioner has identified the cause of death and has communicated that to the coroner's office. Now, the exact purpose of a post-mortem examination will depend on what type of disease is suspected. During the illness of the bereaved, and especially during the later stages of the illness, it is often not deemed in the patient's best interest to be put through an invasive biopsy procedure or surgical procedure. Therefore, sometimes a formal diagnosis is postponed until lung tissue samples can be taken, and that's taken, of course, at the time of the post-mortem examination. Mesothelioma can sometimes be difficult to diagnose as its appearances can differ, and it may be confused with other similar conditions. I'm not going to go into the medical or scientific aspects of that particular exercise and that diagnosis, simply because I'm a lawyer, not a physician or a general practitioner or a trained medic, and it is perhaps for others, including specialist nurses, to assist with that. But for that reason, sometimes the diagnosis can only be obtained through a post-mortem examination. That usually means that where lung tissue samples are taken for histological testing, the testing of the tissues in order for the disease. All that the coroner will look for what material is already available. That might include GP records or summaries of records, hospital clinic letters or discharge letters, results of biopsies that have taken place during the life of the bereaved, specifically looking at trying to ascertain a diagnosis, and also reviews by pathologists of those biopsies which have taken place in life, and as or more importantly, what the family or those closest to the patient know about the patient's occupational history, the diagnosis, and the progression of the disease. And I stress that because, of course, it's the families and or the carers and next of kin's assistants which really assist the coroner when they're looking at investigation and looking at type of inquest is required. In addition, and if it is required, the deceased general practitioner or treating physician, that is the hospital clinician, might be asked to provide a short report regarding the person's health in the months and weeks leading up to their passing, including confirmation of any diagnosis. Now, what happens during an inquest investigation? Well, as well as those medical investigations mentioned, and as well as those investigations which include the collecting together of reports, the coroner will also investigate how and when the deceased may have been exposed to asbestos. A first-hand witness statement taken in life, such as by a solicitor as part of a claim, is often the best form of evidence to show asbestos exposure in detail. That might be because a solicitor, as part of a claim, has looked at a comprehensive detail and comprehensive history of the occupation and employment of the deceased. But if that is not available, either because it hasn't been done, or because a claim hasn't been started or intimated, or a claim is not envisaged, then the family, next of kin or carers will also be, or can also be, very helpful to provide the coroner with that kind of information to help the coroner with the investigation. Now, to help further, that might simply be a sheet of paper setting out, or an email setting out what the family's belief is about where their loved one worked, what type of work he or she was involved in, and how, in their belief, that person was exposed to asbestos. Now, once a coroner is satisfied that they have all the relevant information, the coroner will formally list a date for inquest. Another question that's key: how long does an inquest take? How long does the whole investigation and process take? Well, if a post-mortem examination is not required, and I should say in my experience, in the majority of cases, a post-mortem examination is not required. If it is not required and the coroner has sufficient information concerning the cause of death and any diagnosis of mesothelioma, the inquest can be conducted within a few weeks. That is, within a period of 14 to 28 or 35 days. If a post-mortem is required, an inquest can be listed for several months into the future, or longer if further specialist histological testing or medical evidence is required. Now, my own experience of being a coroner as a part-time coroner since 2013 and as a full-time coroner in the last 15 months is that it is unusual for an inquest to take place more than 3 to 6 months after a person's death from mesothelioma. But I fully understand that different areas have different processes and sometimes take longer. I'm also fully aware that in the post-COVID pandemic period, there is a backlog of cases in a lot of coroner areas, and the recovery period means that some inquests are taking longer than others. But in my area, Leicester City and South Leicestershire, we try as well as we possibly can to ensure that mesothelioma inquests are heard within weeks or a couple of 2 to 3 months from the date of the deceased's passing. At all stages in any event through the investigation, families or carers can expect the coroner's office, through its officers who assist and maintain with the bereaved family, a next of kin or carers on a regular basis, to vital and important and updated information on the progression of the investigation and the likely date of completion. A completion is the date when the inquest occurs. Now, when, where, and how does an inquest take place? The coroner's officer will provide notice to the deceased family and the next of kin or carer of the time and date of the inquest and ask whether they wish to attend. All information that is to be relied upon by the coroner will be supplied to the family or their legal representatives, if they have any, in good time prior to the inquest hearing. I've mentioned legal representatives, solicitors. It's not necessary or vital for a family to be represented, but they may wish to be. The family do not have to attend the inquest, but they should always be given the option to attend the inquest remotely, that is online, or in person. In the majority of cases, evidence will not be heard formally in court from witnesses because it won't be necessary. Rather, the coroner will read and consider the relevant evidence that's already been shared with the family and reach a conclusion on the basis of that evidence as shared with the family. When opening an inquest and when completing an inquest, the coroner asks him or herself 4 main questions. Who was the deceased? When and where did the deceased die? What was the medical cause of death? And how did the deceased come by their death? As you can probably understand, and for mesothelioma inquests, questions 1 and 2 are relatively simple to answer usually, and questions 3 and 4 may be the more difficult questions to answer. To answer question 3, the coroner will review the reports or statements provided by the deceased treating clinician or the general practitioner, along with the postmortem report, if one is available, to determine whether or not a diagnosis of an asbestos-related condition can be supported. When I say supported, a coroner looks at whether it can be supported on the balance of probabilities. That is, it is more likely than not that an asbestos-related condition or exposure to asbestos caused the condition which led to the deceased's death. A coroner does not have to be sure beyond a reasonable doubt. Following on from this, and to answer the final question, how did the deceased come by their death, the coroner will evaluate all of the information provided, including any information provided from the legal representatives, if they've been involved, and ask him or herself what role asbestos exposure played in causing the deceased's diagnosis and subsequent death. If the coroner is of the belief or knowledge on the evidence that's been provided and shared with the family that asbestos caused the condition which led to death, a finding of death by industrial disease will be made, and the conclusion will be industrial disease if all of those factors and criteria is met. That means at the completion of the inquest, when the coroner has either heard or read the evidence in front of the family if they want to attend, or without the family present if they do not wish to attend, the coroner will complete something called a record of inquest, which details all the information to be available and provided for the purposes of registering the death, but will also answer the question how the deceased came by his or her death and give a conclusion. The answer to the question how might simply be the date of diagnosis, the main information about asbestos exposure, and the date of death and the place of death, be it at a hospice, at home, or at hospital, for example. The conclusion will simply be industrial disease if the coroner is of the view that, for example, asbestos exposure has caused the mesothelioma from which the patient has died. Now, briefly, what happens after an inquest? Although the coroner's role is not to apportion culpability or guilt into any party, that is, it is not the coroner's task or role. In fact, the coroner is not permitted to find anyone to blame. But that to one side, a finding of death caused by an industrial disease can provide a family with some level of closure, answer some of their questions in relation to what might have happened with the bereaved years and years ago, sometimes when they worked in a setting where exposure to asbestos occurred. So it is hoped, certainly by the coroner's team and officer and by the coroner, that some level of closure might be given. As importantly, finding of an industrial disease conclusion may well be supportive in any legal claim, although it's important to say that the coroner cannot provide legal advice, and that would be for a bereaved person or their family's legal representative. Once a cause of death has been finalised and the conclusion reached and the record of inquest completed, that record of inquest can be provided or will be provided to the family, to their legal representatives, and to any other interested person. For example, excuse me. For example, it may also be provided either by the solicitor or by the coroner's officer direct to any insurance company if they seek it or need it in order to deal with a claim for life insurance. But once the cause of death has been finalised and the conclusion completed, the family or next of kin can obtain final death certificates and formally register the death with the local register office. Certainly in my area, the registry office is in the same building, the town hall in Leicester, as the coroner's office and coroner's officers are working. So it is hoped that that is a relatively simple process. Once that has been completed, both the coroners and the registration services have completed their role, and it is certainly hoped that the bereaved family, next of kin and carers can then move on and proceed in whichever way they wish. I hope that very brief and whistle-stop tour to what the coroner does, what the coroner's task is, and what the coroner's office and coroner's officers should do to assist those who are dealing with a bereavement is helpful. Thank you for listening, and I hope it has been of some assistance to you. Thank you.
Thank you, Nigel, for that first session for today. If you have any questions, would you put them in the chat box feature on the meeting? At the end of the session, we're going to bring the speakers back, and you'll be able to we'll be able to ask the questions on your behalf, and they'll answer them for you. For our second session this morning, I'd like to welcome Natalie Craven. Natalie is a project manager at Breathe Arts Health Research, managing a number of both participatory and live performing arts programmes for staff and patients at Guy's and St Thomas's Foundation Trust. These programmes aim to boost wellbeing and create a positive impact on the healthcare environment. And Natalie's colleague Edmund is going to be doing a practical session in one of the breakout rooms just before lunch. Welcome, Natalie.
Good morning, everyone. It's a pleasure to be here. Thank you for that introduction. Yes, my name is Natalie Craven and I'm Project Manager at Breathe Arts Health Research. And I'd like to thank Liz Darlison, who invited us here to speak today. So I'm here today to talk to you about one of the programmes that I run called Breathe Sing for Lung Health. Firstly, though, a little bit more about Breathe. We are a not-for-profit social enterprise with a team of 12, which celebrates its 10th anniversary next year. We design and deliver creative programmes underpinned by scientific research to improve health and wellbeing. Our innovative and artistic approach to transforming healthcare experiences offer those we work with a sense of empowerment, hope and creative fulfilment when they need it most. Our work is designed with artists, scientists, healthcare professionals and patients to meet specific clinical and wellbeing needs. We deliver a diverse range of evidence-based participatory programmes and live performance events across a range of art forms, and we believe in a collaborative and creative approach to healthcare, working closely with a group of artists, musicians, dance practitioners, poets and even magicians to deliver our work. We also believe in artistic excellence and the quality of the creative intervention. All our freelancers are paid professionals and they're experts in what they do and are paid fairly for their time and their work. We receive core funding from Guy's and St Thomas charity to carry out this work, but as a social enterprise, we're also able to fundraise as well. I'm just switching over my slides, which I don't think is working. So my role at Breathe, there we are. My role at Breathe is to manage the work we deliver to staff and patients at Guy's and St Thomas in London. And my colleagues look after our national programmes, of which these are just a few that we run across the UK. For some examples of the work at Guy's and St Thomas, we run a 10-week group dance physiotherapy class for older patients to improve their strength and balance, led by a dancer. We run a resident musician programme where a number of talented musicians visit wards, units and staff wellbeing areas to reduce stress and anxiety through uplifting live music. Again, these musicians are experts in performing in a healthcare setting, engaging with those they meet, adapting to the space they're in and selecting the appropriate music. So we have lots of stringed instruments, we have lots of harps, guitars, violins. We don't go in with a brass band causing chaos into a ward. NHS staff wellbeing has been a higher priority than ever in the last 18 months, and our staff wellbeing offer has always been a strand of our work, but has grown considerably during the pandemic to support staff. We run an NHS choir called Breathe Harmony, who released their first single last year, and have worked on a number of virtual performances during the pandemic, including appearance at the BBC VE Day celebrations last summer. In the past 18 months, we've also set up an online evening dance class for staff to switch off and forget about their day, and an online lunchtime drawing class called Creative Breaks, led by an artist, which is designed to fit into a lunch break, encouraging staff to take a break and switch off for 30 minutes. So these programmes were really born out of our conversations with staff who we work really closely with, and we heard that they weren't taking a break and they missed going to the gym and feeling like they had done something for themselves and exercise. So we really listened to the staff before we create a new programme. Over the last 18 months, with restrictions on our lives, we are all more aware of our own personal well-being and what can help us feel a sense of connection, feel inspired and feel cared for. Many people during this period of uncertainty have taken solace in the arts and creativity as an outlet for expression, maintaining a routine and discovering new skills and passions. We're encouraged by this greater awareness and understanding of personal well-being that we hope will continue to help the arts and health sector become more embedded in the NHS and patient care. And I'm just trying to switch my next slide, thank you. And now to what Breathe Sing for Lung Health is. Our Singing for Lung Health group was developed in partnership with Guy's and St Thomas Respiratory Team for lung and respiratory patients with conditions including IPF, COPD and interstitial lung disease. The programme aims to improve lung health and help manage symptoms of breathlessness through physical warm-ups that support participants with their posture, vocal exercises and group singing. Common symptoms that our participants live with are breathlessness, coughing fits, and finding everyday activities a challenge as they get out of breath. One of our group describes his breathlessness as if he's carrying a thick, heavy cloak around his shoulders. And this breathlessness can lead to a much less active lifestyle, which we know in turn can lead to further health problems. At Breathe Sing, we work with a number of talented vocal coaches specifically trained in singing for lung health, who are experts in breath control and vocal training for patients with breathing difficulties. We sing songs from around the world that are specially selected to challenge and stimulate physically as well as cognitively. Many of our songs also include long phrases that participants are challenged to sing in one long breath. There's also particular emphasis on lengthening the out breath and emptying out the lungs, and encouraging deeper breathing and the use of the diaphragm to prevent what clinicians refer to as stacking breaths, when lots of short breaths or in-breaths from the chest can contribute to a feeling of breathlessness. Really importantly, the group also provides a fun, safe, supportive community. Our singers have told us they feel less like patients and more like a group of friends that come together to sing. They even refer to themselves as not just a singing group, but a singing family. Everyone can sing, and in a Singing for Lung Health group, it doesn't matter how well you think you can sing. It doesn't matter if you need to stop partway through a song to cough. You are around people who understand and accept you. Participants tell us that singing together has been helpful in countering some of the stress and tension of living with their condition, and is something to look forward to in the week. The referrals process can vary, but patients are mostly referred to us directly through the lung clinic at the hospitals and by the lung nurses and their team. And we also promote directly to patients in waiting rooms and public areas, as we understand the importance of patients having a choice and to feel a sense of ownership over their care. Thank you. Onto the benefits of Singing for Lung Health. So it's an arts and health initiative that started back in around 2007 at the Royal Brompton Hospital in London, when a member of their arts team observed a pulmonary rehab class and realised the natural connection between the exercises that were being taught to patients in the gym and the exercises that singers would use to warm up. Since that time, the initiative has received significant, albeit slightly sporadic, funding that has trained hundreds of Singing for Lung Health facilitators and has produced thousands of advocates from lung and respiratory patients who have benefited from the programme. And one of the key developments is that the British Lung Foundation has got behind this initiative as a way to support people with lung diseases. There are a number of physical, psychological and social benefits that have a positive impact on the quality of life for participants. So it improves their breath control, as I mentioned, and detracts from the breathlessness. It offers tools for self-management outside the group for posture, breath and anxiety. So these exercises that people can do when they're out and about and they feel that breathlessness coming on. And it specifically is tailored for respiratory conditions, unlike normal choirs. And again, the social participation reduces feelings of isolation in an enjoyable musical activity. I hope that many of you have heard the term social prescribing. Social prescribing enables GPs, nurses and other primary care professionals to refer people to a range of local non-clinical services to support their health and well-being. It seeks to address people's needs in a holistic way, and it also aims to support individuals to take greater control of their own health. So for instance, if you were to have a fall, a group physiotherapy dance class may be prescribed to you as part of your rehab. And other examples may include volunteering, arts activities, group learning, gardening, cooking, and a range of sports. Pre-pandemic, our group met at the South Bank Centre in London, and we were kindly hosted by their creative learning team. During COVID-19, we quickly adapted the delivery of Breathe Sing to virtual sessions on Zoom, as we knew the pressing need to support this vulnerable group. The online format has flourished as an accessible place that could be joined from home during lockdown and maintained that sense of connection and community to help combat isolation, especially for those living alone. Several of our group also joined from their hospital beds online, whilst particularly unwell but not wanting to miss a session, which was amazing to see nurses around their bedsides. Group members who were shielding reported how important it was for them to feel able to take part from the safety of their own home. And also, singing while muted on Zoom helps enhance the existing failure-free environment. Last year, we actually increased the number of sessions that we were offering, and the group ran every week of the year apart from Christmas. So we really believe in a long-lasting, sustainable and reliable group that supports our participants. We also introduced an open mic section where the group share solos, read poetry, or share something they've made during the week. And it seemed that the group were much less inhibited to share personal stories and songs as they were in their own homes. I wouldn't have ever thought that some of the group would have sang a solo in front of everyone when we were all together before 2 years ago. If I could switch to the next slide, please. Thank you. Last September, in between lockdowns, we visited the homes of 4 of our inspiring group to create a series of short films that told their stories. We work with a brilliant filmmaker, and we have done for the past 10 years, that helps us create lots of these. There's lots more of these on our YouTube. Andy has been part of our Breathe Sing programme for 4 years, and we're going to watch a short film about him now.
My condition is called idiopathic pulmonary fibrosis, and it affects you with shortness of breath, as if you've been running, but it's like that all the time for any sort of effort with me. It's progressive and there's no cure for it. So, and every now and again you get a flare up of the disease, and I'm now on oxygen 24/7. That's a bit better. Ah,
Andy.
hello.
Morning, Andy.
The singing relaxes me, and the warm up before you start is like any warm up if you're doing exercise, because you're exercising the lungs. It's singing through your stomach rather than just out your breath. And we've all become friends.
Oh, when the saints go marching in.
We were rehearsing in the Royal Festival Hall, which is quite empowering. But from home, well, we all didn't know what to expect, but actually it's very good. If you don't feel quite well, you can still do it. And yeah, we're all communicating more than you do before lockdown, really.
Shine on me. Shine on me.
After the session, it's a mental feeling of well-being, actually. If you're well, you're well, rather than ill. And it is thoroughly worth joining. It's good work that should be carried on.
Bye, everyone. Love you all.
Bye.
Bye, Rajan. Bye. Bye.
Well, first of all, I'm really surprised because he always hated singing. He always said, "Oh, I can't sing." But I have to say, it really does give him a lift. He really enjoys it. He looks forward to it.
It's something to look forward to in the week.
Yeah.
It really is.
It takes him away and it makes him forget what he's got, but at the same time, he's breathing as he should be. It's just an all-round thing, really. Very beneficial.
So I hope you enjoyed that film, and please excuse our old branding on the end of that video. So I also want to talk to you about evaluation of our work that's really important in what we do. It's a key part of our work, and it's embedded in every project from start to finish. And each of our programmes is backed by data to support our creative approach. Last year, we carried out a thorough external evaluation of our work in a very tumultuous year, and one in which we had to adapt very quickly. So a slightly odd year to do a big evaluation, but that's external funding for you. So last year, we had a relatively normal start to last year. We were still able to run our programme as normal with public events in the hospitals. And overall in the year, we were able to run 237 events. And 90% of our participants across all programmes reported a positive impact on wellbeing in the period before COVID. And then during COVID, with lots of other varying factors affecting this reduced slightly to 88%. Our Breathe Harmony NHS Choir single, that's the stats, 74,847 views of our online single. And the stat at the end I also wanted to mention is 61% of respondents across Guy's and St Thomas believe that arts programming to be an essential part of good care. So I just wanted to highlight this and put it into context slightly, that we asked people, are the arts for you as part of your care an added extra? Are they fine, take it or leave it? Are they important or are they essential? So 61% of people said that this was an essential part of good care. If I could have the next slide, please. There we are. And then to dig a little deeper into our Breathe Sing group, this was the response from them, their evaluation as well. And just to say, the number there is 15 patient participants, and this is actually the recommended number, the group size of a Breathe Sing for Lung Health group to feel the benefits for everyone. And the quote there on the bottom right is from one of our group who was particularly unwell, but she said that singing has helped improve her lungs by 10%, as told to her by her consultant, and how singing has helped her in that. Before the pandemic, as Andy mentioned in his film, we used to meet up at the South Bank Centre, a non-clinical environment where they felt more like a group of friends. And this summer we've also been able to meet up a couple of times on the South Bank Centre's roof terrace garden, which is open to the public, which I definitely recommend you go and have a look. The first time it was windy and rainy, and the second time it was 28 degrees. But that's British weather for you. But it was really amazing to be back with the group in person, see each other, and also our songs, lots of them are taught in harmony. So we haven't been able to hear those harmonies on Zoom. So it's amazing to hear all those voices around us. And participants told us how much that meant to them to be back together. We also we're kind of offering a hybrid version at the moment where we'll meet up in person, but mainly online. So we're offering to both people who are online and people who aren't. And a bit about the development of our Breathe Sing for Lung Health programme. We've now expanded into Warwickshire after we won a tender put out by Warwickshire County Council early this year to run 5 groups of 10-week programmes. And one of the Warwickshire group who has just completed the programme told us that I've never had so much energy and felt so well. I no longer fear getting out of breath because I learned how to slow things down and get control back. This course, along with the rehab, has been the best thing ever and needs advertising everywhere. I really can't thank you and the whole team for helping me really live again. P.S. Walked 4 miles with a £15 backpack, pushing a wheelchair, and yes, a little out of breath, but wow, I did it and felt great. Couldn't have done that 11 weeks ago. And this is from a participant who's been dubbed as Rockstar Steve. If I could have the next slide, please. So I also wanted to highlight a couple of other projects that we have been a part of and been involved in. This is Art by Post, again at the South Bank Centre. No, we're not sponsored by the South Bank Centre. We just work closely with them and they very kindly offer us space there. And this was a project that began during the pandemic and reached 4,500 people UK-wide in their homes, and creative booklets were designed by artists and sent through the post, as the name suggests. And then participants would go through these booklets and follow some of the instructions or suggestions on how to be creative or make something and send it back. So our Breathe Sing group, several of them took part in this project. They wrote poems, and these have all been collated into an exhibition that's now on display in the South Bank Centre. That's open to the public and is also touring the UK over the next year. And this is Alan on the right here, and he is one of the core members of our group who is there every week. And I think it's fair to say he was the most sceptical about singing and how that could help his breathing. He's had a number of health conditions over the years, and at the first session he kind of thought, you want us to do what? You want us to sing? And then he has now written a book of poems which has been published, and he's part of the South Bank Centre. So we're just really inspired by his positivity, despite, as you can see there, he's carrying around some oxygen with him. So his condition has been up and down, but he's just the most positive person despite it all. And secondly, I wanted to talk about if I could have the next slide, please. Excuse me. This is a project called the Singing Hospital. And this was a really special project and performance by 3 Singing for Lung Health choirs, performed to an audience at the Royal College of Physicians in London in 2019. And this performance was commissioned by Arts Council England and produced by the team at the Royal Brompton, and it marked the 10th anniversary of Singing for Lung Health. And composer Victoria Hume, who's also a pioneer in the arts and health sector, she created a new piece of music that was performed by 50 singers. And it was a real celebration of the achievements and many of the patients who had benefited from the programme over the years. So Victoria, she went along and she talked to them, and they knew her fairly well already. And from their discussions, from the phrases or the words they said she put together a composition which was premiered at a really special event, very moving and very emotional. And finally, I wanted to talk about some signposting. If I could have the next slide, please. So, as I mentioned, British Lung Foundation are really behind this initiative, and this map shows the 70 Singing for Lung Health groups that are across the country. And this is from their website, and they have lots of signposting on there if you're interested to find your local group. However, it's sad perhaps to say that this map might not look the same today as it did 2 years ago. But lots of groups are finding inventive ways to keep connected and keep singing. And there's a few other links on there that might be of interest. The musical breath is a really interesting one. This is the website of Feeney Cave, who is really a pioneer in Sing for Lung Health and has trained hundreds of singing leaders. And there's a few choirs on there as well, which aren't specifically lung health choirs, but are open and online choirs as well. And the Singing Hospital project, which I just mentioned, if you search that on YouTube, you can watch the full video of that. So thank you very much for having me today. Finally, you're all invited to join a taster session of Breathe Sing at today's event at 11:55 with one of our specialist Singing for Lung Health facilitators, Edmund Jeffrey, who has been working in the field for a number of years, and he'll be leading one of the breakout sessions. So I'd really encourage you to take the opportunity and try it for yourself. Feel the benefit of singing, and I can almost guarantee you come out feeling boosted, lighter and smiling. And thank you very much for having me, and here are some of the details. If you wanted to find out more, you can email us, have a look at our website. Lots more films about our amazing participants on our YouTube as well. Thank you very much for having me.
Thank you, Natalie. So what an incredible organisation to be a part of. The patient quotes were amazing, and we really would encourage anyone who's interested to join the breakout session later. Can we just say thank you to Slater Gordon for sponsoring that session. We're grateful to all of our sponsors today. As we've been reminding you throughout the morning so far, just please continue to ask any questions that you might have, and we will put them to Natalie and the rest of the panel later. I know that there was some connection issues just at the start of the day. Please rest assured all the sessions are being recorded, and they'll be available later on the Meso UK website. So don't worry if you've missed something that you particularly wanted to see. It will be available to you later.